So thank you for coming out today. We're going to have a presentation about dementia recognition and treatment. I usually tell people a little bit about myself before I get started, so you know if the person that's speaking to you is qualified or not. It's nice to know. So I'm a social worker. I've been a social worker for 23 years. I have always specialized in Alzheimer's disease, end-of-life care. I was administrator of an Alzheimer's secured facility for 5 years. And this has just kind of been my dedication. And I'm a nationally certified care manager. So I've worked with seniors for a really, really long time, seen a lot of dementia care from early stage all the way till the end when someone's on hospice. Okay, so everybody asks, is it normal aging or is it dementia? So let's demystify that a little bit. So long-term memory loss, that's not a part of normal aging. If you really do have long-term memory loss, probably by that time you're in the moderate stage of Alzheimer's disease. Okay, usually Alzheimer's disease or dementia usually starts with short-term memory loss, and often it starts with depression even. Lots of research being done between depression and dementia. And most people who are diagnosed with dementia, if you look back 5 to 10 years prior to their diagnosis, many of them, over half of them, have been treated for depression. And it's not that they have major depression that they've had throughout their life. They've had some episode of depression, whether it's circumstantial from a death in their family or if it's just brought about. Short-term memory loss. Things you might want to think about is sometimes you enter a room and you wonder, what did I come into this room for? But about 30 seconds after you leave the room, you usually remember what you were there for. That's part of normal aging. Somebody with dementia will not remember what they had entered the room for. Same thing with word finding, when you're trying to think of someone's name or you know the name of an object, but the word is just not coming to your head. That happens to all of us. It's a normal part of aging, and I think it's just part of a busy life. Functioning is impaired. That's not a part of normal aging. That's really one of the red flags that this is probably something more, that it's not just memory loss, because people with dementia, like I said, they forget how to do things in steps. That's why they have such a hard time with their activities of daily living, okay? Progression, if it's progressing, might be dementia. It interferes with your thinking, yes. If it interferes with your normal daily activity, you should go see a doctor. Okay, as I said before, age, biggest risk factor. Family history. I don't want people to think that Alzheimer's disease and dementia is hereditary. However, if you have what's called young onset disease, which means that you were diagnosed prior to the age of 65, or more in reality, if you've been symptomatic prior to the age of 65, because most people don't get their diagnosis until about 2 or 3 years after they've been having symptoms, okay? So that's considered young onset. Young onset Alzheimer's disease is found to run in families. Obviously, the family history like heart disease, the high blood pressure, those kinds of things can contribute. Plasma homocysteine, it's an amino acid that helps build protein. And so what they're doing is they're finding people that have a higher than normal level of this plasma homocysteine in their blood work tend to be at a higher risk because they tend to develop more of those plaques that I talked about on the brain. And then MCI, MCI, mild cognitive impairment. Has anybody ever known someone diagnosed with MCI? Yes, okay. The biggest difference between MCI and dementia is MCI has enough memory loss that it is noticeable. On a day-to-day basis with that individual, it's noticeable that they're having memory loss. The difference is it doesn't progress beyond memory loss. Whereas dementia, it often starts with memory loss, but then it starts inhibiting people in their daily activities, their activities of daily living. They no longer can, if they can't, maybe they can still get dressed, but the process of selecting an outfit becomes very cumbersome for them because it's hard for them to do sequential tasks or make decisions. Somebody with mild cognitive impairment, all they have is a memory problem, okay, and nothing else. Some people stay like that, or if they develop it late enough in life, all they ever have is mild cognitive impairment. But there are many people where MCI eventually advances into Alzheimer's disease. And then Down syndrome. Years ago when Down syndrome children were born, their life expectancy was just in their early 20s. And one of the big reasons for that is because Down syndrome children typically have poor hearts. But now, with the miracle of medicine, and we have better prenatal care, right? We can correct things prenatally before they're or during gestation, and better treatment for their heart problems. People with Down syndrome are living longer. So what we're finding is when they're all aging into their late 50s, almost 100% of people with Down syndrome are developing Alzheimer's disease. So we talked about some of the risk factors. Now let's talk about prevention. So what are the benefits of knowing the risk factors? Knowing risk factors give you an opportunity for prevention. And remember earlier we talked about family history and how people with vascular disease also tend to have heart disease, high blood pressure, maybe even diabetes. Those are the lifestyle changes we can make that will help reduce our chances of vascular disease, especially vascular dementia. So live a healthy lifestyle. Eat foods that are low in fat, eat brain healthy foods, things like blueberries, green leafy vegetables that are high in amino acids, even really dark chocolate that's at least 65% cocoa, and even coffee are all brain healthy foods. Don't smoke. We all know that to reduce heart disease and other diseases, including diabetes and high blood pressure, not smoking, not drinking excessively, all of those are good ways to reduce your chance of dementia as well. Research has really found that no matter what age you are, it's important to exercise your body and your brain. So even if you're sitting here and you're over 80 years old, it's not too late to get outside, start walking, exercise your body, challenge yourself by trying to learn new things. If you do crossword puzzles, do Sudoku instead and really get your brain working. Take a class, learn to knit. Even learn a musical instrument or try your hand at learning a foreign language. All those types of brain activities help keep your brain stimulated and reduce your chance of Alzheimer's disease and dementia. It's very important as a caregiver that you also care for yourself, especially if you're the spouse of the person with Alzheimer's disease or dementia and you're trying to care for them. Can you tell me if something happened to you tomorrow, what would happen to the person that you're caring for? It's really important to have a plan. And as much as we think that family will rally around us and help us, sometimes it doesn't work out that way. So as a caregiver, burnout is really a major factor, and your health is a major factor. And it's your responsibility to care for yourself because there's not somebody else there to do that for you. So there are some things you can do to care for yourself. And I always say that we need to care for the patient and the person caring for them, mind, body, and spirit. First of all, if you're still trying to care for somebody in their home, you can hire a company like ours to come in and provide you respite care in the home on an hourly basis. There's also many day programs in our community. And it's really important, I think, to set aside some money to manage what you need as a caregiver. I know we think that services are expensive, but if your health is jeopardized and that person later needs full-time care instead of family care, or if you have out-of-pocket medical expenses, that's going to be much more costly than just caring for yourself now. So you really should look at, are you having signs of depression? Are you having signs of fatigue? Make sure you go to the doctor once a year and get a good workup that you don't have high blood pressure. Because really, if you're not there to care for the individual, they're going to be left without a caregiver, and unfortunately that sometimes leads to early placement. I think it's also important to get yourself involved in a group. The Alzheimer's Association has a good list for you, but there are support groups for people with the frontal temporal that I talked about, with Lewy body disease. There are support groups for young onset or early stage dementia that both the caregiver and the patient can go to, especially if you're a couple, if you're a spouse. It's just really important to acknowledge all the losses that happen when you're a couple and one of the people has dementia. There are just so many issues of grief, of all the plans that you had for retirement that have now changed, and it's a lot to work through. So it's really important that you talk to somebody, that you care for what your emotional needs are, that you maintain your physical health, and that you continue to be there to be a good provider and caregiver to the person that you love who has Alzheimer's or dementia.